Now, the ongoing pandemic has pushed 1 in 5 people around the globe under a lockdown. The virus continues to take new countries under its radar each day, and the epicenter keeps shifting. The World Health Organization has said that the United States could now be emerging as the new epicenter after China, Europe. Now it's shifting to the United States. In the last 24 hours, 40% of the cases that have been recorded globally have been confirmed in the United States alone. And the country has recorded over 11,000 fresh cases of the coronavirus infections, and more than 200 people have lost their lives in the last 24 hours. While the virus is spread to all 50 states in the US, President Donald Trump at this point of time was heard trying to downplay the entire situation, where he said that he hoped that the country will be reopened by Easter.
Ultimately, the goal is to ease the guidelines and open things up to very large sections of our country as we near the end of our historic battle with the invisible enemy. It'll go on for a while, but we win. We'll win. I said earlier today that I hope we can do this by Easter. I think that would be a great thing for our country, and we're all working very hard to make that a reality.
But the state of New York is not on the same page. New York City's mayor, Bill de Blasio, has called his state the epicenter of the outbreak in the United States. The city of New York has about 1/3 of the cases that have been confirmed across the nation.
We're now about 58% of the cases in New York State, and still about exactly 1/3 of the cases in this entire nation. So we are the epicenter. I don't want us to be the epicenter, but we are the epicenter of this crisis for this nation. And obviously, as we discuss this each and every day, because we are the epicenter for this nation, because we are the nation's largest city, because the entire nation depends on New York City, we need more federal help, and we need it quickly.
All right, so that is what is being said in New York. So there are two conflicting kind of narratives that are emerging from the United States. On the one hand, Donald Trump has said that the United States will defeat the virus by sometime mid-April. And on the other hand, there's also Mayor and the Governor of New York who have said that the month of April and May could actually be worse than what is happening right now.
I have to respectfully disagree with him when he says, as he said earlier today, that he's not looking at months for this crisis. I have to say, Mr. President, I wish that was the case for New York City. I hope that's the case for other parts of the country. But right now we are looking at months. And I'm going to say it again because people deserve the honest truth, that we are doing all we can just to get through March right now, particularly in terms of our healthcare system. April will unquestionably be worse than March. And right now, my fear is that May could be worse than April. That's the reality we're facing. I think the notion that we could be, quote unquote, back to normal in the month of April is absolutely inconceivable at this point.
The United States has also recorded this pandemic's first known child death. A youth under the age of 18 from Lancaster has reportedly succumbed to the virus. While the exact age, gender and medical history of the child is not known, experts are of the belief that even juveniles, though seem to have a milder form of COVID-19 illness, making this a one-off situation. While we speak, the United States Senate House is currently discussing the $2 trillion stimulus package that Donald Trump had hinted at just a few weeks back. The package aims to provide a $1,000 check to the affected citizens, and this is to address the economic fallout from the coronavirus outbreak.